Hello! In this video, we will demonstrate how to effectively perform proactive and purposeful hourly rounding with your patients. Our goal is to create consistency in hourly rounding in an effort to provide the highest level of service to every patient, every time. We'll start with a look at the 5 fundamentals of service we call ADET. You learned about ADET during your SHARP orientation. You may even have a reminder card about it behind your name badge. As you know, ADET stands for Acknowledge, Introduce, Duration, Explanation, and Thank You. Watch and listen for the points of ADET while we show you an example of a nurse checking in with her patients while covering the 4 Ps: pain, potty, position, and proximity or placement. Depending on how the patient answers each question, you will either take some appropriate action or move on to the next P. Let's take a look at an example of hourly rounding using ADET and the 4 Ps.
Hi, Mr. Garcia.
Use your patient's name as you enter to acknowledge them as a person.
It's your nurse, Melina.
Introducing yourself can help put the patient at ease. As a nurse, patients perceive you as a trusted confidant and advocate.
I'd like to take a moment
Letting the patient know the duration of your visit.
to check in with you about a few things.
The goal of the E in ADET, explanation, is to care out loud. As the provider of care, you should narrate out loud what you are doing to or for the patient. For rounding, this means after you have acknowledged the patient by name and introduced yourself, your body language needs to convey that you care, while your words say something to the effect of, "It will take me a few minutes to ask you a few questions that will help me determine if all your basic needs are being met. I want to be sure you are being well taken care of and have everything you need." We'll cover the T in ADET after we now discuss the 4 Ps. The first P you will address in your hourly rounding is pain.
Are you comfortable? Are you in any pain right now?
No, I'm not in any pain.
Okay.
If the answer is yes, assess the situation and treat their pain accordingly. Once you've helped manage the pain, or if the answer is no, move on to the next step, potty or toileting.
It's been a while since you've used the restroom last. Can I assist you now?
No, I don't need to use the restroom.
Okay.
If the answer is yes, be sure to mobilize the patient with the appropriate equipment and/or assistance based on the communication board you updated at the beginning of your shift. After addressing toileting, or if the answer was no, you can move on to initiate repositioning.
Well, are you comfortable right now, or would you like me to help you reposition?
No, I'm fine right now.
Okay.
If repositioning is needed, make sure you have the appropriate assistance and/or equipment, again based on the communication board you updated at the beginning of your shift. If the patient does not need to be repositioned at this time, you can move on to the last P, proximity or placement.
Well, before I leave, I want to make sure you have everything within your reach. You have your call light and your urinal, but let me move your bedside table a little closer. And before I leave, is there anything else that I can help you with?
Not at the moment, thank you.
Okay. Well, as a friendly reminder, make sure you use your call light if you do need help.
Thank you.
Thank you.
And we wrap up rounding with the T from ADET, which is of course, thank you. To recap what you've just seen, it is important to follow the principles of ADET when rounding with our patients. And remember, the 4 Ps consist of pain, potty, positioning, and proximity. Thank you so much for watching.